Hello, welcome back. We are ready to move on to the last parts of the skeletal system, which will include the pelvic girdle. Those are your two pelvic bones that encircle the lower inferior portion there of the axial skeleton, or compose that portion. And then the appendages, which are, of course, going to be the leg bones. And so for this video clip, we're going to talk about your pelvic bones. Each of your pelvic bones consists of three regions, 1, 2, and 3, and we'll talk about what the names of those are. So you have that on the left, and then you've got those three regions over on the right. Together, those make up your two pelvic bones. Together, those can be called the ossa coxae, which literally refers to hip bones, because if you remember, coxal region referring to the hips. Os coxa is singular. And so this is kind of like we saw with the sternum and the sacrum and the coccyx before. The reason you have these different regions in the bone is because they start off during fetal development as separate ossification centers. So they start off as separate bones, but eventually they blend together into one bone there on each side. All right, so let's take a closer look at the pelvic bone over here on the left-hand side. I'm going to hide some of these ligaments. So you got a lot of ligaments in here that are helping support the pelvic floor. You know, you've got a lot of weight hanging there over the bowl that's formed by the pelvic cavity, as you can see there. So you need a lot of ligaments. Ligaments are very tough, dense, regular connective tissue, helps hold everything in place. I'm going to get rid of some of the ligaments up there as well, so we can see the bones in a little bit more detail. Now here is your femur, that's your thigh bone, and of course that is forming a joint with your hip bone or pelvic bone on each side, forms a nice ball and socket joint. Move this up, and that is wrapped up in lots of ligaments. So there you can see, here's your femur. So it certainly has a ball-like feature on there, which is fitting inside a cup-like feature on the lateral side of the os coxa. So let me hide the femur, and we can kind of zoom in here. That cup-like feature is called the acetabulum. So you'll have one of those over here as well, of course. Acetabulum literally means vinegar cup, so apparently this was named by the Romans, who thought that that looked like a little cup like they would put vinegar in that they served at their meals. Vinegar is dilute acetic acid, so hence the name acetabulum. Another big hole you'll see on here, and this is one of your features for the pelvic bones, that is called the obturator foramen. That's the biggest hole in the skeletal system, and just like other foramina we have talked about, you have blood vessels and nerves that pass through there. All right, and as I mentioned earlier, each pelvic bone is divided up into three regions. So this uppermost superior region, we'll rotate that around, that is called the ilium. So if you guys remember back in Unit 1, I said ilium would come back up again with a different spelling. So I-L-I-U-M, ilium, and there's just one L that refers to this portion of the pelvic bone. I-L-E-U-M, hopefully you remember, was that third section of the small intestine. All right, then you have this portion of the pelvic bone on each side. That's called the pubis, or your pubic bone. Some people will refer to that as the pubic bone, but it's all continuous with these other parts of the pelvic bone or the hip bone. All right, that's the pubis. And then this lower posterior portion is called the ischium or the ischium. It's I-S-C-H-I-U-M. C-H usually in Latin is pronounced with a K sound. All right, so how about some of the features on here that are listed there on your lab guide? So we did the acetabulum and the obturator foramen. And then up here at the top, all right, there's the ilium. So up there at the top, and you've got this over here on this side as well, there's your right ilium. That border there along the top, that is the crest of the ilium, or the iliac crest. Which that's what, if you're poking around and feeling where your pelvic bone may jut out, That's what you're feeling, the iliac crest. Okay, next feature there, sacroiliac joint. So you can tell by the name that's going to be a joint between the sacrum right there and then the ilium on each side. Okay, so the sacrum forms a joint with both your left and your right ilium, and there are some ligaments wrapped around that joint to hold it together. And you can kind of see if we zoom in here, those bones come into very close contact, so you're just going to have a little bit of fibrous, dense connective tissue in between those two bones. And let me deselect all of these guys. Let me hide the sacrum. Oops. Goodbye, sacrum. All right, so if we do that, notice there are all kinds of ligaments back there as well, helping to hold this into place. See how you've got a rough patch right in there? That is where the sacrum articulates with the left ilium of the os coxa. You'd have the same kind of thing over here. Yeah, you can see it. The ligaments are still in place, but right in there you've got that similar location. So this is the location of the sacroiliac joint. All right, next feature, greater sciatic notch. Or maybe you've heard of the sciatic nerve before. That's a very large nerve that extends off of the spinal cord and is passing back behind here and then heads down towards this little indentation. Well, not little, that's a pretty big indentation, as you can see if I rotate this around. That is called your greater sciatic notch right in there. So the sciatic nerve on each side is going to pass, here it is over here, will pass through that notch on its way towards the leg. And people who pinch their sciatic nerves, a lot of times maybe they're bending over and the sacrum and the ilium separate a little bit, and when you stand back up, those bones may come together, and boom, you might wind up with a pinched sciatic nerve. All right, so you've got the greater sciatic notch, and then just below that, inferior, that is your lesser sciatic notch. It's kind of passing its way through there as well. The pelvic bones are very complex. These are bones that you really cannot study effectively from a three-dimensional diagram. You've really got to see it on video or use one of these 3D virtual anatomy type apps to take a look at it more closely. Very difficult to study from diagrams. All right, some additional features on here. The ischial tuberosity, what is that? Okay, so this is the ischium. You got one over there as well. And you can see here where it hangs down the lowest, the most inferior portion. You've got that curve. That is the ischial tuberosity. Tuberosity, that's another name for a bump or a curve. We had the radial tuberosity on the radius bone in the forearm. This is what a lot of people call their butt bone. When you're sitting down on something and you feel a bony prominence, it's the ischial tuberosity that you're sitting on. All right, another feature here, the pubic symphysis. All right, so that's the pubis portion of the os coxa on the left, and there it is over there on the right. And then right in here in the center, you've got this little gray padding there, and that is called the pubic symphysis. It's a fibrocartilage pad. So it's cartilage, but unlike your rib cartilage, your nose cartilage, it's got a lot more protein fibers in it. And so it's very good at resisting compression, resists being pulled apart because you've got a lot of collagen in there. So it helps support the joint between the pubis on each side, but it's also flexible. You know, it's not super flexible, but it provides some flexibility there so you don't have a completely rigid border all the way across the anterior portion of your pelvic bowl there. That's important during childbirth. In females, you need a little more flexibility there to squeeze a baby through the pelvic floor. All right, that's pubic symphysis. You also have symphysis type joints between your vertebrae, the bodies of your vertebrae. You've got fibrocartilage pads, those intervertebral discs, that also form that type of joint. We're going to talk more about joints over on the physiology side of Unit 3. And the last little feature, let's deselect all those. Well, let me leave the pubis on each side highlighted. If we kind of rotate upward this way, right along in here, you've got that V shape right there. That is called the pubic arch. Kind of look at it from around the back side over here. Pubic arch, or if you were looking down into the bowl of the pelvis, like that. Pubic arch, kind of forming that V shape right in there. And all right, when we talk about gender differences between male and female skeletons, this is actually a male skeleton that we're looking at right now. The pubic arch, the angle of it will be much wider on females. I bet you can guess why that is. Females develop a wider pubic arch because they have to squeeze the heads of babies through the floor of the pelvis, and it would not fit through the sharper angle that you have, the sharper pubic arch that you have on a typical male. All right, so that's all the features. What I'm going to do before I end this video, let's see, I'm going to highlight the left os coxae. I'm going to hide everybody else, just so we can take a look at just this bone by itself, so you can learn to recognize the features without seeing any of the other bones it is articulated with. So this is a disarticulated os coxae. It's been separated from all other bones. All right, so if you have one sitting off by itself, the acetabulum is always on the lateral side, all right, and the ilium sticks up in a superior direction. So if you were just handed this, you can tell, first of all, this portion of the pubis is going to curve around toward the front. That's going to be on the anterior side. Ilium actually is up, superior, but it also curves around in a posterior direction. So it's not too hard to orient these once you get used to handling them. And this would also tell you that this is a left os coxae, because the acetabulum is going to be on the lateral side. All right, then you've got your ilium, pubis. Oops. No. Okay. If you rotate this around, there's your sacroiliac joint. That's going to be on the posterior portion of the os coxae. Obturator foramen. Right in here, this is where you're going to have that pubic symphysis. That fibrocartilage pad would be sitting right in there to form the joint with the other pubis. There's your ischial tuberosity, your butt bone that you sit down on. If we keep rotating this around, and this is going to be on the medial side, so it's going to be opposite of the acetabulum. There's your greater sciatic notch, and there's your lesser sciatic notch. So I think that covers the os coxae pretty well for you. Next, we're going to be moving on to the bones of the legs.